fall into the water like Peter.
Nice and relaxed. Nice and relaxed. Relax. There you go again. Now let me get you on your stomach. You can do it. Trust me, you can do it. Now another thing that we have to overcome, which is really interesting, is fear. Oh. Because a lot of people are fearful. This chiropractic treatment looks a lot worse than it really is as far as what the patient is experiencing. And if you noticed, he used his elbow in order to get him up. Now, did he really need to use his elbow or not? It was the fear that if he didn't use the elbow, he would have pain. My guess is that even if he didn't use the elbow, he still would have been able to get up. And my feeling is, just from already feeling what's going on here, that most of the pain that he's been experiencing and the spasms are already down. Now what I'm doing is something called pressure points or trigger points. There are specific points in the muscle that if you hit them when you're doing it, it does give him some additional pain. But what we're doing is we're overstimulating the sensory nerve, and when you overstimulate the sensory nerve, it causes the motor nerve, which controls the muscle, to relax. So what we're doing is a way of getting the muscles to relax without injecting it, or without taking any muscle relaxers, or without taking any painkillers. And after I'm done doing this, well, we'll see how he's doing. Now, along with the chiropractic treatment, we do other types of therapy in order to help the patient. We do ultrasound, we do heat, we do massage, we do electrical stimulation, we do paraffin, we do traction, we do all kinds of things that will help aid the adjustment, because once you get the vertebrae into alignment, you want the vertebrae to stay in alignment and to hold in place. And that doesn't always happen just on one treatment. That's why patients are given a period of time and an amount of treatments to get before they get to the point that they're feeling good. And not everybody gets the opportunity to get their chiropractic treatment on camera. Okay, now what I would like you to do for me is to sit up. And face Rami. Now, what I want you to do is to go from the sitting to the standing position, thinking that you're not going to have any pain. In other words, just like I go from sitting to standing, I know that I'm not going to have any pain. But when you've been having sharp pain, the initial reaction that a lot of people have is that they anticipate that if they do that, the pain's going to come back. So let's see what happens.
So, I'm saying after 3 days of suffering, I mean, my wife saw me this morning.
Well, let's have you walk up and down the hall so Rami can take the picture of you.
85%.
85%.
Yeah.
Okay.
85%.
Good. Walk so you can see how. I don't know if you can notice from this picture,
Yeah.
but you can see that he's a lot straighter. Whereas when he walked in, he was what they call antalgic. He was all crooked.
Right.
No, don't show us because we don't want to pull it out of alignment because it's not as stable as it needs to be.
85% better.
There you see a typical case of somebody who has a severe problem, antalgia, leaning, probably a problem in the disc area, but by getting things realigned and taking the pressure off the nerve, most people would say, es un milagro, it's a miracle. It's not a miracle. It's God's healing and using me as a vehicle in order to move the vertebrae into proper alignment. And once the pressure is taken off the nerve, then the healing energy flows through and the patient gets great results. So I hope you liked it. That was not rehearsed. That was not anticipated. That was just God sending them in to give you all an opportunity to see how it works. Thanks.